My patients kept on asking, "Doc, why do I get skin tags?" This was such a common question that I decided to dedicate the entire video to exactly this topic. What's behind skin tags? What causes them? Are skin tags hereditary? And what skin tags really mean will be answered today. A part of the video will have a special section on what different colors indicate. And at the end, you'll also find out how to make skin tags stop growing. First, let's orient ourselves. Are we talking about the same thing? Or, in other words, is it a skin tag or not? Skin tags are rather easy to distinguish, although some may look like warts or moles. There are 4 features specific to skin tags. 1. Skin tag looks like little outgrowths hanging loose. They might show up anywhere, but 2 most common locations are neck and armpits. To compare, warts seldom show up on necks or underarms. 2. Skin tags are relatively small. They rarely get larger than 5 millimeters or 1/4 of an inch. 3. Skin tags may be either flesh-colored, slightly lighter or darker than surrounding skin. Colors can indicate different diseases risks. More about that in a minute. 4. Skin tags are completely painless. However, they might hurt and bleed when they get caught in necklaces, and they might get itchy when rubbed by garments. Good news is that skin tags do not turn cancerous. The bad news is that some forms of cancer can look exactly like skin tags. If you're not sure, better have a health professional look at it. But what's behind skin tags? Well, that depends whether you ask a dermatologist or a functional medicine doctor. A dermatologist will likely tell you that skin tags are nothing to worry about, but a functional medicine doctor might have a different opinion for a reason. While a dermatologist is interested in what problems skin tags can cause in the future, a functional doctor is also interested in skin tag causes. In other words, he's keen on discovering what's behind skin tags. Are skin tags hereditary? They are less hereditary and more lifestyle dependent. Notice, they don't appear at birth. They pop around 30s and increase in numbers as we age. By the time we get to a retirement age, 3/4 of us will have them. Genetic factors are suspected, as skin tags are shown to run in families. However, exactly how much that is due to nature versus nurture is still to be determined. As of today, it appears that skin tags may not follow a family tree as much as they follow a family dietary habits. So what causes skin tags? Absolutely, the biggest reasons behind skin tags is poor metabolic health. Skin tags are common in obesity and are very much tied to a larger BMI or body mass index. According to several studies, the higher the body mass index, the larger the number of tags on the skin. One study pointed out that skin tags are significantly more common in people with BMI over 30, with about 6 out of 10 people having them. What's more, skin tags not only prefer overweight people, they actually like the ones with the largest waist circumference the most. Losing a few pounds and flattening a protruding belly may be a good way of having skin tags stop growing. Excess weight and skin tags go together. But there is another interesting correlation. It's skin tag color and disease risk. Watch out for dark or multicolored ones. Multicolored skin tags are more common among obese, as well as diabetics. Cardiac patients have significantly more multicolored tags on their skin as well. To compare, flesh-colored skin tags belong mostly to people with lower heart disease risk. In summary, what's behind skin tags? Skin tags are linked to obesity, and especially obesity with large waist circumference. Multicolored skin tags are also linked to higher risk for heart disease. That's good to know, but it's time to find out what really causes skin tags and why they are accompanied by high BMI, larger waist, and higher cardiovascular risk. It happens that large belly and high blood pressure have something in common. They need a stimulus to grow beyond healthy limits. It happens that that's the same stimulus skin tags need to grow as well. This stimulus is called insulin. Excess insulin triggers several biochemical pathways that stimulates growth. Excess insulin typically follows an onset of insulin resistance. As you may know, insulin resistance is the precursor to type 2 diabetes and prediabetes. You may be now thinking, I don't have diabetes or prediabetes, so why do I get skin tags? Diabetes and prediabetes are not the same as insulin resistance. Insulin resistance appears much earlier, way before any signs of prediabetes or type 2 diabetes can be noted. Insulin resistance may be present even a decade before a doctor can make a diabetic-related diagnosis. This time discrepancy has a reason. While diabetes is routinely tested, insulin resistance is not. Hence, many people are under the impression that they are perfectly healthy. Meanwhile, they may be one step away from a diagnostic surprise. If you see a skin tag growing on your neck or somewhere else, please make sure to be tested for insulin resistance. Not diabetes or prediabetes, but insulin resistance. For that, you have to ask for a test called HOMA-IR. It's not a routine test, and not every healthcare practitioner may be familiar with that. Regardless, please insist, because skin tags may be your first sign of metabolic ill health. What are the chances of being insulin resistant? Apparently, only 12% of adults and only 7% of overweight adults are fully insulin sensitive. Let me repeat that. In-depth studies reveal that only 1 out of 10 people is truly healthy. But these poor odds get even worse when there are multiple skin tags on the body. People with skin tags are over 11 times, not 11%, but 11 times more likely to end up with a metabolic syndrome. That is especially true for people that carry high fasting glucose, high triglycerides, and low HDL, popularly known as good cholesterol. So, what's behind skin tags? To sum it up in one sentence, poor metabolic health and inferior carbohydrate metabolism. Next time, when you see yourself in the mirror and ask, why do I get skin tags? And are tempted to remove those nuisances, know that they may actually be talking health language. Look at them as the early indicators for higher cardiovascular risk and possibly already existing insulin resistance. So while a dermatologist might not give two thoughts about your skin tags, you should, because now you know what skin tags really mean and what causes them. Can skin tags fall off on their own? No, they don't, but they can stop growing when you get an A in health, which includes better insulin sensitivity, so why not? If you need help with getting there, please look up our courses. Otherwise, subscribe and press that bell to get notifications, because more interesting videos are coming.